Endorsed by this station. Opinions expressed are not necessarily those of radio station KMET, its management, employees, or affiliates.
Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice in beautiful Encino, California. This is KMET 1490 AM ABC News Live, and I'm here with my colleagues, my business partner, and my dear friend and best friend, Dr. Robert Jaffe. And we are starting our new program today, a 2-hour show back-to-back. So welcome to all of you and welcome to our new group of listeners. And we're so excited to be here today with our fresh, brand new start. Dr. Jaffe, here you are. Here we are.
Here we are. We're doing our 2-hour show. We're so pleased and we're so happy to be doing this. Hopefully, this is going to be impacting our listeners in a positive way. We're here to teach you how to learn how to be more loving to yourself and to the people around you. And we have a lot to say. We're also very interested in getting feedback, so anybody who would like to call in, you're free to call us. Number is 951-922-3532, 951-922-3532. And as you said, we're doing a back-to-back show, but if you're looking at us on FaceTime Live, you're going to see us front to front. So.
Okay. Yes, you and your jokes, you know, they are unique to Dr. Jaffe.
Unique to
right?
me.
Yes. So we would like to, definitely encourage you to call us. I'm going to repeat the number one more time, and we're going to repeat the number across the show several times today.
Right.
951-922-3532. You can also watch, our archive programs at SoundCloud KMET 1490 page, and simply go to playlist and click on Heart to Heart. You can also visit us at, our YouTube address is heart-2-heart.online/YouTube. And please introduce this program to those that you believe they can benefit from. So the way that our program is going to work, back to back, basically we used to have a Friday program with Dr. Robert Jaffe leading about trauma, addictions, and codependency impacting relationships. And we had our usual Thursday program, which I talk about human sexuality. So we merged the two programs, so now it's one program. And we are going to be talking about all of that, primarily, sexuality at the first part of our show, and then addictions, trauma, codependency impacting relationship on the second half of the program. And then at times we may actually, share the topics and, kind of bring everything together. So it depends on how it goes and where it goes, the show is going to play out. And we would like for you to be the guest of our show by sharing your experience, by sharing your comments, and this is how we're going to grow. And hopefully this extra time is going to give you kind of more time for you to be able to join us, right? And after all of this, if you still are not comfortable to do that, we understand. We do welcome, your private, contacts via our emails, which they are posted on our homepage at KMET. So, Dr. Robert Jaffe.
Yes, ma'am.
At this hour, we usually talked about something about, human sexuality.
We do.
And, in my talks with my patients and hearing it from other people, And I had a 2-hour, presentation last Saturday, which I was talking about human sexuality and all of that. And then I realized that some of the gentlemen who were sitting there, they were uncomfortable. And to my surprise, actually, majority of the participants were male. There was very little female, present. Either my talk was so boring for them, I don't know, or was it only exciting, for guys, or they thought I'm going to be talking about porn. I don't know what was going on, but for some reason, there was very limited, female participants, and it was, of course, on Zoom. However, one of the gentlemen asked, made a reference to, indirect reference to sexual difficulties, challenges among men. And so it made me think, okay, well, maybe this is a good time to talk about that. And then also last week, you and I made a reference about some of the sexual challenges, and we started talking about, describing some of the male challenges. Right. And we talked about the fact that men usually don't want to admit that they have a problem. Right?
Yeah, and of course, a lot of that is culture.
Yes. Ego.
And ego, yeah, and so men who struggle with erection difficulties, either difficulty maintaining an erection, or having premature ejaculation where they can't last as long as they would like to, or retarded ejaculation where they last but they can't ejaculate. These are not uncommon.
They're not.
They're not uncommon.
They're not uncommon.
But they can't, and there are things that can be done to help the person, but we can't fix something if the person isn't willing to admit that that's going on.
Exactly. And in general, for men to admit that they have a problem, in this case of discussion, I'm referring to erectile dysfunction, as you also talked about it, and that's going to be the topic. Usually we see, depending on the culture, right, since you also mentioned culture, there are in some cultures within the United States, I mean, this is a diverse nation. So we see that within cultures, there is still the fact that the view of a man can have a sexual problem is very hard to accept, but the impact of male sexual dysfunction, shows itself in female, right? Because when they have sex, and that interaction can also impact a woman in a negative way when there is a erectile dysfunction going on.
Of course.
Right? However, we see that, men who don't want to look at themselves and understand the issue that they have, they blame the female partner for lack of connection, or, coldness during sex, or not having the desire, not wanting to have sex, never initiating sex. So the blame and the attention goes to the female lack of or limited performance and limited, interest to have sex with a partner, right? And within the same cultures, it's seldom for a man to take a look at, himself, to say, hey, wait a minute, maybe I had something to do with this, right? And then I have seen that usually men of certain culture, they pick physicians of cultural background, because it's easier for them to obviously talk in the same language, and then both culturally can relate to each other. And, it's really interesting to see that years of going to medical school is not able to kind of remove some of that embodied cultural factor, even in physicians, right? So, but there are facts that erectile dysfunction, when it happens, it impacts the sexual relationship. It actually impacts the whole relationship. It impacts the marriage. impacts, relationship with sexual relationship, and ultimately any romantic relationship is going to be impacted by that. And no, a female has nothing to do with that. And also female on their own, they may have their own, challenges going on. So, but that's totally different from male erectile dysfunction.
Mm-hmm.
And so some of the factors that causes, male erectile dysfunction, basically, it's a very complex process, right? So it's not just one factor doing that. We are looking at psychological factors, and we're looking at, physiological factors, right? The psychological factors, actually, when it happens, usually that's not erectile dysfunction, right? Depending on the cultural background. And this is a very significant finding in some of the researches that they were done in UK, right? Actually, they were done by my own, colleagues that when I received their articles, it was very interesting finding that what is perceived to be as erectile dysfunction among men is actually, it's not, is actually, something that has to do with their view of, of women, their view of how they look at women, right? So for some, women can be more arousing, for some women can be less arousing, mm-hmm. right? But in general, the first thing that we look at when it comes to male erectile dysfunction, we go to the physiological factor to see what's going on.
And we do that so that we can rule it out.
Yes.
And right. Of course, physiological factors can play a part, or can play a big part in erectile problems. But in the majority of cases, it's not physiological.
Right.
So, but it's important to rule that out.
Right.
And then to discover exactly what's going on, mm-hmm. And that involves therapy.
Yes, mm-hmm. Exactly. So I guess we receive our notice of commercial break. If I'm not, I think I'm correct. About a minute out. Okay, thank you. So let's look at to see what are some of the physiological factors that can cause basically erectile dysfunction. So we're looking at a complex process that involves the brain function, hormones, nerves, muscles, and blood vessels. And of course, psychological part of it has to do with emotions and feelings, and also stress and, some other mental health condition that can impact, erectile functioning.
Absolutely.
Right?
Yeah.
And in this one, in this part, I'm going to primarily be focusing on the physiological factor first, and then if there is time, we're going to go to the emotional part, because these physiological factors sometimes are not addressed, okay, but having the knowledge about them is really significant,
right?
Because not knowing about them is the prime factor that impacts relationship.
Yeah, and it's also self-care. The more knowledge you have, the more direct you can be with your physician.
Exactly.
And ask the physician to test for these particular things.
Right.
Rather than leave it up to the physician, who oftentimes the physicians themselves are not that knowledgeable when it comes to sexuality and sexual issues.
Right. So that's a good part to start after our commercial break.
Sounds good.
Okay. See you shortly after that. Back from our commercial break, Dr. Mitra and Dr. Robert here at Heart-2-Heart program at KMET KMET 1490 AM ABC News Radio. We welcoming you, our new listeners and viewers, to our new time frame program, right?
Right.
2 hour back to back. Instead of Friday, we have transferred that segment of the program to this one. So we are here until 5 p.m. and we are very excited and we are hoping that this new format is going to be more helpful to you and more fun to you so that you can have more time to listen to us. And we would like to also invite you to call us 951-922-3532. So at the first segment, we're going to be talking about human sexuality. And on the second part, after 4 o'clock, we're going to be talking about addictions, trauma, and codependency impacting relationship. Or the two part may actually, kind of merge together at some point during our program.
Absolutely.
Right? So, yeah.
And feel free to call us at any time during the next 2 hours up until 5 o'clock. We're happy to take your call. We're not going to ask any personal information or for you to identify yourself. However, what you can do is you can just give us what's going on. If you want to ask a question, we will take your question and then we will answer it, but we are not going to engage you in a therapy session.
Exactly. So for those of you who just joined us, welcome. And we are talking about male sexual challenges, and today's topic is erectile dysfunction. Before commercial, we talked about how physicians are not volunteering to ask patients whether, for example, did you by any chance experience any, erectile dysfunction, right? In general, we know per my own research studies, which they have been done since 2011 all the way to current time, and there are some articles that they have been published about them. We know that in general, the length of time to educate medical students at universities about human sexuality is somewhere, depending on university, between 12 to 20 hours. Can you believe that?
Yep. Yep.
To me, that was mind-blowing to learn that physicians receive only 12 to 20 hours of human sexuality education. And that education also primarily is focused on sexual transmitted infections, sexual transmitted diseases, and reproductive care, right? So they don't focus on basically what are some of the dysfunctions, how many factors may impact, a male or a female sexuality. And therefore, that lack of training is actually very much problematic in our society.
I think it's very problematic in that our sexuality is so much a part of our quality of life.
Right.
And so physicians are not trained at all really in helping people understand their sexuality or understand if there's something that they can do that's going to help them to feel better about themselves sexually,
right,
and to connect with their partners. So none of that is really a part of medical school agenda, and hopefully that'll change in the future. But until it does, very important for you to take the bull by the horns and to educate yourself and find out as much as you can about this part of your life, which is so vital.
Yes. And that's why we're here. That's why we're providing this education. I remember that some of the implications for practice and policy that we offered as a result of our research finding was just that how we need to encourage medical schools to provide more sexual health education, because human sexuality is part of sexual health. So sexual health, it doesn't merely means that sexuality needs to be disease-free. It's the emotional factor, physical factors are definitely a part of that. And we know that, because of some political and, issues plus the funding issues, human sexuality in that sense is not considered, right? Then the focus of medical school is basically based on disease and, disease preventions and diagnosis rather than, other things.
Right.
Right. So, and basically, that applies to mental health in general. So, let's see, for example, sometimes, a combination of physical and psychological issues causes erectile dysfunction. So it's not just one or the other, right? For instance, a minor physical condition that slows, somebody's a man's sexual response may cause, anxiety about maintaining an erection. So the resulting anxiety can lead to, or, to a worsened erectile, functioning.
Right.
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 So if, we see that how a matter of anxiety, which is most of the time is dismissed, right, can actually, cause a worse condition than that. So let's look at the physical causes of erectile dysfunction, right? Most common causes are, and this is something that we see among mid-age men, right? Like, but I would say, I don't know if that's mid-age, but 40, it starts at 40 usually, right? Heart disease, right? And heart disease is one of them. And then there are some people who have kind of clogged the blood vessels, right? High cholesterol, which, I'm surprised to see that among, 25-year-old men, they have high cholesterol these days. And of course, that has, something to do with their nutritional factor, and all the hidden sugar that people, consume, right? And then diabetes, of course, is one of them. Obesity is another one. And, we see that obesity definitely, both of them, diabetic type 2 and obesity, we see that has significantly increased the rate of it since 1980s. It's been on the rise, it has been. And we see these two actually among, teenagers even, right?
Right.
We have children who are diagnosed with both, diabetes and obesity, right? And then all of that has to do with the number of, quantity of sugar that's consumed every day.
Yeah, it's amazing to me. You did a presentation at Toastmasters on sugar.
Right.
And how much sugar we actually eat during the day that we're not aware of eating, because we're not actually pouring sugar into something, but things are made with so much sugar.
Right. Added sugar.
Added sugar.
Added sugar. Yes. Yeah. We're not talking about sugar that's in the, in fruits, right? We're not talking about sugar that's, is already in carrots, right? We're talking about added sugar. For example, if you remember in my presentation, one slice of whole wheat toast, organic, and it has 4 sugar cubes in it. One slice.
One slice.
So imagine if you have a sandwich, there you go, you already are, biting on 8 cubes of sugar.
Yes. Yeah. Yeah.
And you don't know that, and you think because it's whole wheat, it's already, is natural, it has fiber, it's organic, and so it's safe to eat, right? But it's not.
Right.
I mean, for those who can tolerate sugar, I'm sure it works. But for those that they are experiencing difficulties and challenges, that's one area to look for. Or when you have that, that simple latte, or you have that macchiato, or you have that, those coffee that we need to have it all because we're so addicted to variety of forms of coffee. There is so much sugar. Like I remember that one small macchiato had actually, caramel macchiato had actually 40 cubes of sugar in it. Do you remember that?
I do remember that.
We went and we investigated that. And it's also posted online. I mean, that's public information.
Yeah.
Can you believe that? It's public information and we don't check it out.
Yeah. And to say why sugar is so bad.
Well, sugar is so bad because well, it first of all, it's a substance. Sugar is a substance. Sugar primarily, in particular, sugar that's been processed. I mean, the way that sugar is is being distributed in market, it's a processed sugar.
Mm-hmm.
Perhaps a healthier sugar would be, sugar cane. That would be it. Brown sugar is actually is white sugar with molasses.
Mm-hmm.
So that, let's say if you're having, real molasses added to that, right?
Mm-hmm.
So just because it's brown sugar doesn't make it any healthier.
Right.
Right.
Right. Well, what does sugar do to us?
Well, sugar definitely increases our blood sugar.
Okay.
That's one. It damages, our tooth, our
teeth.
gums.
Uh-huh.
That's definitely another one.
Mm-hmm.
So it impacts, the function of pancreatitis,
Mm-hmm.
right? It creates by the way that pancreas starts to sugar becomes immediate glucose in body, right?
Right.
So pancreas starts to produce, insulin, and sometimes the amount of glucose in our body is way too high that no matter how much of insulin is released, right, is not able to take care of all that glucose and transfer that into our muscles,
Mm-hmm.
right?
So does sugar cause us to gain weight?
Well, yeah, so all that extra glucose that remains unused by insulin and by our muscles, it has no other way of being, metabolized except turning into fat.
Right.
And that fat goes around our belly,
Mm-hmm.
primarily.
Right. So fat is one consequence. But I think what you said about, too much sugar in the bloodstream, that of course can be life-threatening.
Oh, absolutely. Yes. So
because if you have too much sugar, you can actually get a stroke.
Well, when the level of blood glucose increases in body, and we see usually strokes happens early in the morning,
mm-hmm.
right? For those who are diagnosed with diabetic type 2, right? That's a major factor to
mm-hmm.
consider, because for some reason the combination of variety of hormones in our body, including insulin, right? During when a person is sleeping, there is a condition that calls I'm not sure what's the name of it. I remember it. It is called dawn syndrome. That means dawn meaning the early morning.
Yeah.
Right.
Uh-huh.
So what happens as body starts to help us wake up because of the release of those hormones, if there is too much sugar in that can interfere.
Mm.
So we can kind of stay in that sleeping mode, and then that I don't know how that works, but a physician can talk about this more so, and we are inviting physicians to join us to help us with this. But somehow that extra glucose that stays in body can cause a stroke in early morning. Uh-huh. Right? So that's why most people who are diagnosed with diabetic type 2, when they have morning fasting, blood glucose reading is usually the highest mm-hmm. among them.
Right.
But across the day it kind of lowers, especially after the medication is taken. Mm-hmm. But fasting glucose level usually is the highest in the morning. Mm-hmm. Right. And the lowest before somebody goes to bed, mm-hmm. right? So that variation of blood glucose in body, may impact, a man's sexual functioning.
Mm-hmm. Right. Okay.
And then of course, the extra sugar and the extra fat in body, over time, we know that it causes high cholesterol, it causes high triglyceride level, mm-hmm. right? And ultimately, can create heart disease, mm-hmm. right? And if we add alcohol on top of that, then we have the full package of self-destructive behavior.
Right, because alcohol converts to sugar very quickly.
Exactly. Mm-hmm. So we see that, a combination of, and then one of them is metabolic syndrome. That's something that also impacts, male erectile dysfunction. So what is metabolic syndrome? It's a condition involving increased blood pressure, high insulin levels, which we just talked about it, how that happens, body fat around the waistline, and then also high cholesterol. Mm-hmm. right?
Yeah.
So all of these, that extra sugar that we have, that added sugar that we don't recognize it, we don't see it, and sometimes we don't taste it. For example, I remember it was early 90s, late 80s, early 90s, that suddenly low-fat, non-fat, became the fashion.
Right.
Right? So what happens when, for example, one takes away, fat from plain Greek yogurt? It becomes so tasteless, right? So they remove fat, so it becomes fat-free or becomes low-fat. But for taste, when you add sugar to it, you're actually, serving nothing but, problem,
Robbing
right?
Peter to pay Paul.
And there you go. Okay, so uh, if I mean to put it on test, I would like to invite you all to go to supermarket and pick up one non-fat, plain Greek yogurt, and then pick up one high-fat or full-fat or regular, plain yogurt of the same brand. Whatever brand you want to pick is fine, right? So look at the sugar content between the two. You that the one with the one with full fat has less sugar than the non-fat yogurt, right? Per serving. So let's talk more about these findings, right after our commercial break. What do you think?
I think it's a great topic.
Let's do that.
Let's do it.
Talk to you more.
Okay.
Welcome back from our commercial break. Dr. Mitra, Dr. Robert here at KMET 1490 AM ABC News Radio Heart-to-Heart program. For those of you who just joined us, and we are talking about erectile dysfunctions and contributing factor that may cause, this situation, this condition among men, and what to do about it.
Right.
Right. So before our break, we were talking about the fat content and the sugar content, in our food. That fat content is not hidden, but sugar, sometimes we are kind of become confused between, what is, is non-fat healthy, or is it full fat healthy, or is it low fat healthy? So we were talking about how when the fat is removed from something as healthy as, for example, plain Greek yogurt, right? And then when the fat is gone, the taste is gone. So to bring back the taste, there is going to be added sugar, which actually the sugar content of a non-fat plain yogurt becomes higher than when there is a full fat yogurt there. Right. And we actually, sometimes we need that fat, the natural format of it, right? So all this added sugar, all these, hidden sugar that we don't recognize it. And of course, when we say, oh, it's non-fat, so we may even eat double amount of the portion because it's non-fat, right? So it's not going to hurt us. But guess what? The sugar hurt us more.
Yeah, right? Yeah. It's interesting because people, the word fat, right? People don't want to be fat. Right. So you think low fat or non-fat is better for you. Right. Yeah.
Exactly. Of course, we're looking at healthy fats, and we have lots of healthy fats, around us. Avocado is a healthy fat. All the nuts, they have healthy fat. Olive oil is a healthy fat. They call it ghee. Ghee is a healthy fat, and avocado oil is a healthy fat, right? We have so much healthy fat, and then there are some unhealthy ones, like margarine is such an unhealthy fat. If you just leave a pack of margarine on a kitchen counter for a month, nothing's going to happen to it, because it's chemical. Or all that trans fats that we don't want, all that fat that's in the processed meat, like hot dog, like all of that thing, those are the fat that we don't want, and they're easily can be avoided.
Yes.
We don't have to have hot dogs, do we? Maybe once in a while, but we don't have to make it, something regular. Yeah.
Yeah. No.
Because all of that, the diseases that we talk about, the heart disease, the blood, clogged blood vessels, the high cholesterol, high blood pressure, diabetes, obesity, metabolic syndrome, these are all conditions that, are happening because of the unhealthy fat and the added sugar, right? And they show themselves, in sexual relationship. They show themselves in sexual activity, right? So the other conditions that contributes to erectile dysfunction. Pardon me.
Electrical erectile.
Erectile dysfunctions are conditions like Parkinson's disease, right? How about the medication that people take for all these conditions that we just listed, right? We know that medications for high blood pressure, it impacts sexual functioning, right? Why? Because they kind of slow down the metabolism, and the slow metabolism, right, can impact sexual functioning.
Right.
Right.
Yeah, they can also affect how much blood flow goes into the penis.
To the penis, exactly. Yes. So tobacco use, right, is another one. Alcoholic, definitely, and then alcoholism. Substance. Like drugs that we use, or some people who have sleep disorders, right? Insomnia, or people who have breathing problem. What's the term of that? I forgot.
Asthma?
No, not asthma, but sleep apnea.
Sleep. Yeah.
Okay, right. And then those who have prostate cancer or they have enlarged prostate and they are receiving treatment for it. There are also, surgeries or injuries that affect the pelvic area or spinal cord. And also, one of the most important one is low testosterone level, right? So these are all physiological conditions, and there are too many. So it's not just one condition or two conditions that physiologically impacts a man's sexual functioning. Any of them, if it's gone untreated, or if it is under treatment, right, in one way at least, or in so many ways, it can impact, a man's, sexual functioning. It can cause, erectile dysfunction. And if a man doesn't want to look at the fact or check themselves out, or even if they are aware of it but don't discuss it with their physician, so that the physician can come up with alternative forms of, treatment, and then leave it up to the wife or the female partner or any partner that they have to, to take some of the responsibility for the erectile dysfunction. It's not, the problem is not resolved, the problem is not accurately or in a healthy way, addressed and justified.
Right. Yeah. So taking responsibility means that you have to understand that the way that we are built as human beings, it's often easier to not take responsibility,
right,
and to deny that we have any part in what's not going right.
Exactly.
And the more that we do that, of course, the more problems it creates in relationships.
Right.
Yeah.
Right. So we want to be able to have the confidence to talk to physicians when we experience, when a man experiences, I say we, I mean, I don't experience, erectile dysfunction, I'm a female, right? But when men experience erectile dysfunction, it is recommended that for them to talk to their physicians to see how it is happening and what can be done about it. Right. So some of the risk factor, the point is that if this problem goes untreated as the individual gets older, erection might take longer to develop, and it may not be as firm that a man desires to have it, right? So then, that definitely doesn't feel good when a man wants to have, sexual relationship with his partner.
Right.
Right. So to sum up, we know that, medical condition, in particular diabetes or heart conditions, are definitely factors that can cause erectile dysfunction. Tobacco use is one of them. Being overweight is one of them. Certain medical conditions such as, prostate problems, injuries that happen to body, the use of certain medications like antidepressants, and medication to treat high blood pressure are among the factors, and then drug and alcohol use. So how all of these can actually, manifest themselves and cause psychological conditions, right? Because, when erection doesn't happen, there is a, unsatisfactory sex life. There, as a result, there is stress and anxiety. There is a sense of embarrassment and low self-esteem. Ultimately, there is relationship problem, and also there is an inability to get the female partner pregnant, because if they want to have children, it is not going to happen.
Right.
Right. When erection doesn't happen, insertion doesn't, penetration doesn't happen. When penetration doesn't happen, then pregnancy naturally doesn't happen. There are other ways to do insemination, but then again, if a couple want to have, to form a child in a natural way, erection, if it doesn't happen, it's not going to make it, it's not productive. And we see why the issue of pregnancy is a concern these days, is because we see, erectile dysfunction among young generation these days.
Yeah.
Right? Among the young generation, they're not, having problems such as heart disease, maybe, but there is a high rate of diabetic type 2. There is a there's a high rate of use of, drugs and alcohol, right? So just these two to begin with, is good enough. And then smoking, of course, or because of the lifestyle situation, there is a high level of anxiety. There is a work issue problem. There is financial issue problem, right? So all of this can definitely, and depression can, impact a male erectile dysfunction.
Absolutely. Depression and stress.
Right.
And so what is stress, right? So stress is about feeling anxious and worried and overwhelmed with to-do lists, and believing that looking at the glass as half empty.
Right.
And these type of attitudes and thoughts create a stressful reaction in the body, which is constricting.
Yes.
And what causes a lot of times the penis not to erect is the blood vessels in the penis are constricted. And so learning how to relax, learning how to meditate, learning, and of course, physical exercise, these things are expansive and open up the blood vessels and allow the penis to function.
And that's a very good point. And here's what happens physiologically when stress happens. So we know that body has this system of self-regulation. So we heal ourselves essentially. So when there is high level of stress, so our cortisol, hormone starts to develop, because cortisol is a calming, hormone, right? But when cortisol essentially is a form of sugar, right, comes up, then insulin believes that there is glucose there, and insulin needs to come to the plate to distribute all that glucose into our muscles, right? But when insulin is released in our body, and there is no actually form of glucose, right? Because this is cortisol, right? So that insulin and that cortisol, they have to metabolize, like you said, somewhere, right? So they become fat. Right. So you don't have to eat anything to gain weight. All you have to do is have lots of stress to gain weight. Right. So what do we do basically to resolve this? Work with your doctor to manage if you have diabetes or heart disease or any other chronic health condition. Be sure to see your doctor regularly for checkups and medical screening tests. If you're smoking, stop smoking, limit or avoid alcohol, and also don't use any illegal drugs. Exercise, and I can't, say enough about exercise. Exercise regularly. Anything is better than nothing. And then, be sure to take care of your stress, and then also take care of your anxiety, depression, or other mental health condition or concern that people have.
Yeah.
So it's easier to take care of it. If somebody wants to really focus on how to resolve their erectile dysfunction, it's a combination of physiological factors plus mental health.
Right. And so you've given them a lot of information today, and I think that's wonderful.
Thank you.
Yeah, wonderful. And I want to say that to the audience, it's really important that you engage in positive self-care.
Right.
And when you mentioned exercise, you've been doing a lot of exercise
I've been
recently,
doing lots of exercise.
and really feeling good about it. And
you too. You're doing lots of exercise.
I'm doing a lot more than I was,
Yes.
and I'm doing good. And so one of the things that I've learned is that we need to start slowly.
Right.
Slowly, and it's sort of like the tortoise and the hare, right? You get overwhelmed when you start doing it fast, and you try to do it as fast as possible. Instead, a slow, measured approach to every change that you make. Number one, it's good physically to make the changes smaller, but it's also good emotionally, because your subconscious mind has to get used to the idea that you're making a change.
Right.
And if you do it too quickly, oftentimes you do start to feel overwhelmed, and then you stop.
Yeah, I started with 5 minutes. And then it became 6 minutes, and then it becomes 10 minutes, and
One of my clients is doing he got a bike for his garage, and he does 1 minute every other day.
Yeah.
And that's
Exactly.
and that's a good start.
Yeah, that's a good start, And with that, we're completing our first segment of our program today, and we are inviting you to continue to joining us and share this ride with us at 4 o'clock till 5, where we're going to be talking about codependency, trauma, addictions, and relationship. So see you in a few minutes.
See you in a few minutes.